So, have you ever really stopped to think about what happens after a doctor takes a biopsy? It's just this tiny piece of tissue, right? But somehow, it holds the secrets to saving a life. Today, we're going to pull back the curtain and follow that sample on its incredible, hidden journey through the pathology lab.
Right. That's the big question. What happens in that gap? It feels like magic, but it's actually an amazing scientific process. We're going to demystify it and follow that tiny piece of tissue step by step from the clinic to the lab and see exactly how cellular clues get turned into life-saving decisions.
And to make this whole thing feel real, we're going to follow the story of a patient we'll call Aida. Her experience is, unfortunately, a common one, but it's the perfect way to see how all this science directly impacts a real person's life.
Okay, so for Ida, it all starts with an image. A mammogram flags something that doesn't look quite right. The next step, a biopsy. A doctor uses an ultrasound to guide a needle with incredible precision to collect a few tiny cores of that tissue. And just like that, our sample is collected. Its secret journey is officially underway.
So what happens now? You can't just slap that piece of tissue under a microscope, right? It's soft, it's delicate. It has to be carefully, meticulously prepared to reveal its secrets. This is where the amazing blend of artistry and hard science in the pathology lab really kicks in. So how do you turn a soft bit of human tissue into a permanent, readable glass slide? Well, you follow a recipe. It's a precise 5-step process, and every single step is absolutely critical. A mistake anywhere along the line could compromise the diagnosis. So let's break it down. First up, fixation. The second that tissue is removed from the body, it starts to break down. To stop that, it goes straight into a preservative, usually formaldehyde. The analogy here is perfect. It's exactly like pickling a cucumber. The process halts all decay and locks every cell and all its internal structures perfectly in place. Okay, next is embedding. The tissue is preserved, but it's still way too soft to be sliced super thin. So the lab infuses it with and then encases it in a block of paraffin wax. Think about making Jell-O with fruit inside. The wax acts like the gelatin, giving the delicate tissue a firm, stable structure. Now it's ready for the most precise step of all. And this is where the magic happens. A machine called a microtome, which is basically a super precise deli slicer, gets to work. It cuts that wax block into ribbons that are unbelievably thin. We're talking 5 micrometers. To give you some perspective, that's about 10 times thinner than a single strand of your hair. It has to be that thin so that light from the microscope can pass right through it. So we have our super thin slice, but the cells are basically transparent. Pretty useless, right? That brings us to staining. The most common stain is called H&E, and it's beautiful. It turns the nucleus of the cell, its command center, a deep purple, and the rest of the cell, the cytoplasm, a bright pink. All of a sudden, this invisible world just explodes with color and detail. Then it's sealed under a glass cover slip, and voila, we have a permanent record. Now that our slide is ready, the real detective work can begin. A pathologist, a doctor who is a true expert in diagnosing disease just by looking at cells, takes over. They're about to peer into this little city of cells and find the answers. Okay, this next part is really important to understand. The pathologist is looking for 2 key things: grade and stage. They sound similar, but they mean totally different things. Grading is all about the cell's appearance. How abnormal, how aggressive, how chaotic do they look? Staging, on the other hand, is about geography. It answers the question, how big is the tumor and has it spread anywhere else? And you can literally see what they see right here. On the left, you've got grade 1 cells. See how they're pretty orderly? They kind of look like the normal cells they came from. Now look to the right, at grade 3. It's a total mess. The cells are disorganized, they're all different shapes and sizes, pure chaos. And that visual chaos tells the pathologist that this is a much more aggressive cancer. But just looking at the shape and arrangement of the cells, that's only the first step. To really create a personalized treatment plan for Ada, the pathologists have to dig deeper. They need to uncover the molecular secrets hidden inside those cancer cells. And for that, they need some even more advanced tools. This brings us to an amazing technique called immunohistochemistry, or IHC for short. Get ready, because this is cool. Think of the proteins on a cancer cell as being like unique locks. IHC uses special antibodies that are designed to be the perfect key for a specific lock. So you introduce the key, and it will hunt through all the cells to find its one and only matching lock. So how do you know if the key actually found its lock? Well, here's the clever part. The antibody, the key, is tagged. When it connects to the protein lock, a chemical reaction is triggered that creates a color, usually this really distinct brown. So if the pathologist looks under the microscope and sees brown, they know that protein is there. No brown, no protein. It's an ingenious and visual way to see the invisible. So why is this whole lock and key thing so important? It has 3 massive jobs. 1, diagnosis. It helps nail down the exact type of cancer. 2, prognosis. It helps predict how the tumor is likely to act. And 3, and this is a real game changer, therapy guidance. By revealing the cancer's specific locks, it tells doctors exactly which targeted drugs, which keys are going to work. So let's bring it back to Ada. Her cancer cells are tested for hormone receptors. If those locks are present, doctors can use hormonal therapy to stop the cancer from growing. They also test for a protein called HER2, which basically acts like a gas pedal for cancer growth. If her cancer has way too much HER2, there's a specific drug that can shut it right down. These IHC tests are what allow for truly personalized medicine. So after all this work, the basic slide, the grading, the advanced IHC stains, all of these clues are gathered together into one single, powerful document, the pathology report. And this report becomes the blueprint for everything that happens next. That report goes to what's called a multidisciplinary team meeting. You have the pathologist, the surgeon, the oncologist, everyone sits down together. They go over all of Ida's results, and guided by that pathology report, they create a personalized plan just for her. It's the ultimate team effort, and it all started with that tiny tissue sample. You know, for more than 100 years, this whole process has relied on physical glass slides and a person peering through a microscope. It works, it's an incredible system, but it's totally analog. And right now, we are on the brink of a massive digital revolution. The old way is exactly what you'd picture, a pathologist in a lab, physically looking at glass slides. The new way, it's called digital pathology. The glass slide is put into a scanner that creates a gigantic, high-resolution digital image. Now, the pathologist can pull up that image on a computer screen and analyze it from literally anywhere in the world. And the benefits here are just enormous. You get a faster workflow, you can get instant second opinions from the world's top experts, training new pathologists becomes easier and more consistent, and what's really exciting, it creates the daughter foundation for powerful AI tools that can help pathologists spot cancer even faster and more accurately in the future.
So let's just end on this thought. Think about it. What if distance didn't matter? What if no matter where you lived, the absolute best expert in the world for your exact type of cancer could look at your results instantly? That's not some sci-fi dream. That is the promise of digital pathology, and it's a future that is happening right now.